you should be in parasympathetic, which is rest and digest, healing, restoring. But if your body is fighting all night and then you've got a full workload like you do and you're busy, you're fighting during the day. So then you're staying in that high sympathetic season all day, all night.
Matt Woolley Podcast.
All right. Welcome back to another edition of the Matt Woolley Podcast. Today, I have a very special guest. I have a longtime relative, friend, associate, confidant, Dr. Kyle Benton. Dr. Kyle Benton, thank you for being here.
It's my pleasure.
All right. So who is, on this show, we like to give people a little bit of background, and yours is a mile long, so let's get going. These are all good things. Who is Dr. Kyle Benton? Well, Dr. Kyle Benton earned a Doctor of Dental Surgery from the University of Tennessee Health and Science Center. He's completed advanced education in general dentistry, postgraduate residency with a focus on TMD and comprehensive care. You've got Spear Education Continuum, Center for Neural Occlusion Mentorship with Dr. Robert Kirstein, Pankey Institute of Essentials Continuum. You got the American Academy of Craniofacial Pain. You're a fellow.
That's right.
And then International Academy of Oral Medicine and Toxicology. You founded Benton Family Dentistry in Hot Springs in 2010, where you began practicing general dentistry. You also began practicing general dentistry. When you were doing general dentistry, you began identifying the growing need for care in TMD, craniofacial pain, and sleep breathing disorders. You transitioned focus to TMD, craniofacial pain, and sleep breathing disorders. You've completed hundreds of hours of continuing education and training, treated hundreds of patients suffering from TMJ dysfunction, craniofacial pain, and sleep disorders. And now you are the founder and operator of the Restorative Wellness Center in Rogers, Arkansas. And basically you utilize advanced and holistic and minimally invasive techniques to rid people of TMJ and sleep and breathing disorders. Did I get all of it? All right. That's fantastic. There's a lot there. So for a guy that's known you since I've been alive, so for clarity, before we get going on this, let's have full transparency. Kyle and I are cousins. Our mothers are sisters, and I've known Kyle since I was born. He's known me since he was 3 months old. We've done a lot together, and alongside another guy that's been on our podcast, Brian Benton, who is your older brother. We know the good, bad, and ugly about each other, but that's not why you're here today. So I asked you to come on the podcast because I think it's important. What you're doing right now is very important work, and I have a personal testimony involved with that, which we'll get to that in a little while. But before we do that, let's get a little background here. So we heard all of your we've got all the bullet points of your professional career, but where did Dr. Kyle get his start? Where did you grow up?
Well, so I grew up in a small town of Whitehall, southeast Arkansas, about 30 miles from Woodlawn.
Yes.
Small town, where you knew everybody. Grew up, obviously, with an older brother, Brian.
And so that real quick, so that's about 40 minutes. Whitehall's about 40 minutes from Little Rock.
Right.
And about 10 minutes from Pine Bluff, for those that don't know the Arkansas map. It's Northwest Arkansas. Some people know, some people don't.
That's right.
So you're from L.A., Lower Arkansas.
That's it. The sticks.
Yes, the sticks.
Yeah. Yeah.
Anyways, keep continuing.
Yeah. So I grew up in a small town of Whitehall. Slow pace of life. Was really involved growing up in our church. Sports, all the fun things you do as a kid. Did a lot of hunting and fishing. lived in a quaint neighborhood, lots of friends. Fortunately, our family was close, so got to see, of course, you and the cousins dang near every Sunday, it seemed.
Right. At least twice a month.
Right.
At least.
Yeah.
Which is a special.
Yeah. A lot of fond memories out at Papaw's place, right?
Correct.
Had a nice pond, four-wheelers, go-karts.
Yeah, he had it figured out for us.
Yeah. So some of those things I do miss. It was a
very special
good time.
Very special
time. So a lot of that stuff, of course, molded me being around our family and just seeing how a family operates, right? How important that is, right? Even though now we've expanded, right? It's a lot more difficult to have those gatherings because, like you said,
there's a ton of people. It's good. It's good though.
It's a good thing.
It's good though. But the legacy continues. That those type of lessons that we learned and those as a youth has expanded into our older age, and those are things that might hit our TV. Those are things that you can't take away, but always stick with you. So you grew up in Whitehall, graduated from Whitehall, and then you came up here to the U of A and was for 4 years.
That's right.
What was your degree in at the U of A?
It was a really, really unique degree.
Oh, yeah? What was it?
Biology.
Nice. Makes sense. Makes sense. So I know you went up here. You went to the U of A. You were in Kappa Sig. You got your degree in biology, and then at what point did you decide that you were going to go into dentistry? Where was that turning point for you?
Yeah, so my freshman year, I was pre-med, so I was considering medicine initially or anesthesia via the nursing program. So I had a family friend back in Whitehall, Russ Beavers, who was a nurse anesthetist. And he kind of inspired me to consider that path. So I was pre-med initially. And then seems like towards the end of my freshman year, I had a really close friend, Bryant Sizemore, who's from Watson Chapel, which is another lower Arkansas area. He was gung-ho about being pre-dental. And he was president of the dental society, the local dental society at the U of A. And he told me, he's like, man, dude, dentistry sounds like a good gig, man. I think you need to, check it out. Come to a meeting. We've got some dentists that come in and speak on, what they do, what a dental practice looks like, how they help, how they serve, how they're involved. And so I did. I just went to a meeting that they had and really just felt like, man, that sounds like something I want to consider. So I went ahead and made the switch. And from there, started getting shadowing hours at local offices. I worked for a longtime oral surgeon, Dr. J.B. Hayes, who's kind of an OG up here.
OG.
Yeah. And also shadowed Dr. Pierce Osborne, who's Dr. J.B. Hayes' son-in-law. So he's a periodontist up here, and he's a part of probably one of the biggest.
So when you were there, you got a feel for it, and you liked what you saw.
Yep.
Very cool.
Yep. Started kind of understanding what it would look like.
Did they start when you do that kind of thing? Do they start you out like working like a dental hygienist, or do they show you the whole ropes of everything so you understand everything before you go into it? How do they do that? Like whenever you're kind of just shadowing, are you just watching? Or
well, it's really you're watching for the most part. Now I worked at Dr. Hayes' office, so I was able to sit in on surgery. So I was assisting surgeries.
Oh, nice.
But it really depends on what your goals are. So I always recommend to young aspiring dental students, one, don't get a biology degree. Okay. No. You're going to get plenty of sciences, get your prereqs, plenty of sciences in dental school. You need to pursue some type of accounting, finance,
business fundamentals,
marketing, something
right.
That route. But as far as experience and shadowing, that's up to the person. I recommend trying to hit up every discipline you can. So shadow a general dental office.
By discipline, you mean?
general dentistry, right?
Okay.
Pediatric dentistry.
Every little nuance of the
Endodontics, which is root canals, oral surgery,
Gotcha.
periodontics, which is gum and bone.
Mm-hmm.
Yeah, so just to get an idea of what types of dentistry there are,
Mm-hmm.
to see if you're led in one way or the other. But
Okay.
a lot of dental students don't really know what direction they want to go until they get into school. So
Gotcha. All right. So you transitioned to the University of Tennessee Health and Science Center. How was that experience?
wonderful. Yep, Memphis is great food, great fun, right? Still close enough.
Safe town.
Right. Fortunately, we lived in a safe area, right? There are some.
I do.
sketchy areas.
I like Memphis for what it is. It's just like any place. I always give it. The problem is if you're from Arkansas, you hear Memphis and you think of awesome music, awesome food, dangerous city.
A lot of wonderful memories, great times. The school's wonderful, man. Clinically, you're going to be more prepared than most, to be honest with you. Clinically, that school is sound. Had a lot of great friends. A number of them I still talk to today, of course, colleagues. So, but wonderful experience at University of Tennessee.
So you went through that program, graduated, did well, and then you set up shop in 2010 in Hot Springs, where you founded Benton Family Dentistry.
Right. A unique name.
Yeah. When we were mulling over names, where did you?
See, that's the thing. So right out of that AEGD residency, that's kind of what got me interested in TMD. So that laid my foundation.
No, we're going to get there. I know this story, so I'm going to try to lead it along a little bit because I know I've seen you because of the closeness and us working together on things and certain things. Like I see what where it went, how it evolved. I know that let's speak real quick to you had your trade, but let's speak real quick to the entrepreneurial avenue that is part of starting a new business. What was that like as a young guy fresh out of college? Because I know that you purchased an existing business that was a decent clientele that kind of was, somewhat established, not as established as you made yours.
Well, it was established, but that dentist had passed away.
Right.
Crash. So the practice was kind of being supported by local dentists. So it was dying, unfortunately. But it was a wonderful thing. It was a blessing that I was able to come in.
So what was that like? Because, you're fresh out of school, you're doing your thing, you're full on in practice, there's that piece of it. Everybody just suspects that, that's your primary focus, and it is obviously, but there's another side to it because whenever the patients stop coming in for the day, what are you doing? What are you doing 2 hours before they come? What are you doing 2-3 hours after they leave? What was it like trying to grasp the business side of things, while trying to grow a practice and be active in marketing and be active in all the things of business? What was that? Was it a grind?
It was a grind, and you're never going to be ready. You're never going to be prepared because, to be honest, it was kind
of like having kids.
Right. It's kind of like ignorance is bliss, right?
Right.
I did not have a clue. All I knew is I wanted to own a dental practice. I wanted to serve patients, right? I loved working with my hands. I loved working with people. I loved helping people. So I didn't have a marketing plan. I didn't, the business plan that I did have, I can't believe that the bank approved it and gave me money. Really? I mean, I didn't really have a clue.
Well, yours is a sure thing, though. That's the one thing that I will say for certain industries. Unless you're a dummy, you're not going to mess it up being a lawyer, a dentist, or any type of doctor for that matter. You know what I mean? So they are coming from the financial standpoint. If they think somebody's bright, 100%, you have a little leeway because they know you're going to be able to perform your job.
Correct. Yes,
but I still think that's humble of you to say that you didn't have it. well?
Well, because in that 5
You know what
years,
you don't know.
Yeah, with that 5 years, it was heavy dentistry. They don't teach you anything about operations, marketing, finance, accounting, any of that stuff. So that's stuff that you have to learn as you are growing your practice. There's some folks that are gifted and they already have that knowledge, right? Or that may have pursued a different degree and then went to, the dental or medicine route. So they already have that foundation. So fortunately, though, when I bought this practice, the older sister of the deceased dentist was the office manager. So she kind of showed me the rope for 6 months. So I learned quite a bit in the 6 months, which was good. But that's when the learning begins, right? The schooling is just the first layer. So it's the school of hard knocks, really. So then you start to piece things together, right? And if you have that entrepreneurial spirit, you're going to figure out how to make it happen, right? You're going to connect with the right people, and you're going to fail, learn, right? Evolve. So it was a process, man. It was a grind for the first couple of years.
What's your greatest takeaway from these learning times? First thing pops in your head.
To be honest, and it really depends on what season of life you're in. The biggest takeaway for me now is there's never a destination, right? It's just the journey, man. You need to appreciate the people that are on board with you, that are on your team while they're there. Show as much appreciation as you can for those that are dedicated to your mission. And when you're at work. When you're at home, be at home. That took me quite a while to figure out, even though I still fight it at times, but you can't do it all, and you got to have enough left in the tank for those that you love, right? So
Absolutely.
your family.
Absolutely.
There's a lot of takeaways that I've had over my time. Again, it's just different seasons of my life. Because when I started out, I wasn't married, right? It was just me and my oldest son, Braden. So I didn't have a whole lot of other responsibilities. Just the practice grew, and I had more people depending on me, right? Then I got married. Then I had kids. Then it just gets a little more complex. So then you're having to really be more intentional.
Be intentional.
Yeah.
So in that time, you began getting into what your complete focus is now. So you're doing general dentistry. You're doing all the things plus a few extras that, general dentists do. But you started getting into the TMJ and, sleep disorders and that sort of thing. And I remember, wasn't that like year 4 or 5 or something like that? Or you kind of had something there, but you really jumped into okay. So number one, I may be wrong on that, but what inspired that decision to go into that and be transparent here? What was the root cause of you looking into this and moving forward and, being so educated on this matter?
Yeah.
So
in 2008, while in dental school,
okay,
I went through ortho, which is braces. So correcting my alignment of teeth. I did that a second time. After I got my braces off, I started developing a pop and click in my joints, my jaw joints. Started developing pain. Okay. Didn't know a whole lot about that. Schools didn't teach you much about it. I said, it'll go away, right? It didn't. So I fought it for years, had, headaches, pain when functioning, chewing, eating, clenched and grinded my teeth at night. So this got me thinking of what's a solution, right? So that's kind of why I pursued that TMD comprehensive care residency first, to get a foundation, because it was led by a guy named Steve Cloyd, who is a Pankey Institute alum, which the Pankey Institute's one of the big names in dentistry. It's in Key Biscayne, Florida.
Okay.
They do a lot of high-level training there. So that kind of laid the foundation for me. And I wanted answers, right?
Mm-hmm.
Because we were always told that, well, I mean, noises, yeah, they happen. If there's no pain, or if it hurts every now and again, don't worry about it. Well, what we know now is joint noises are common. They're not normal.
Mm-hmm.
Okay. And as I started seeking treatment on myself, I was going to continuing education, to, continuums. I was trying to absorb everything I could. So I've treated myself as well, because I've experienced most everything the patients that come to me experience. I've experienced that. So as I continued to open Pandora's box, right, I started looking at different modalities, different philosophies, different solutions. And the older I've gotten, the more I realize, man, if you can put the body in a position to heal, a lot of times it can, because inflammation's our enemy, right? So inflammation and pain is what we treat. And that's what I was seeking. So how do we do that? But then there's a whole lot of, underlying factors, risk factors, right? Signs that we're evaluating too. But it seems like it was when I started my Pankey Institute continuum, and they started really talking about the airway. That's when it started making sense to me, with jaw joint dysfunction, craniofacial pain, and airway issues, sleep breathing disorders, right? Because it's all connected, head to toe. If we have pain, we're going to make certain postural compensations. We're going to position our body in a way where it relieves the pressure of the pain. If we're not breathing properly, we're going to make posture compensations that strains muscles in the neck and in the jaw, that holds the jaw.
Everything's a cause and effect.
Everything, right? Yes. So that just started kind of opening my eyes. And it's one of those things, and to be honest, I think this is why there's a lot of general dentists that don't go down this path, because once you see it, you can't unsee it. And then if you're bogged down with a lot of general dentistry like I wasn't able to serve these patients and treat these patients like I wanted, like I felt like they should be treated.
Well, I remember it seems like you had told me a story, one thing I think that helped, correct me if I'm wrong, push you over the edge. Wasn't there a woman that you treated at one point?
Oh yeah.
So let's talk about that, if you want to.
This gave me some chills thinking about that. So yep, had a mom of 4, and this was back in my previous practice. This is when I was just connecting dots. She was going back to school, raising a family and working. So she was spread thin, but she came to me. She was coming for a hygiene visit, and looking back, the signs that I saw
now
in her mouth, right? I know now. She had a jaw joint issue, for one, a pop click. She had some dental work that needed to be done. But what I did not really understand is the sleep breathing issue that she had. And she was supposed to come back and start dental work, to get going on dental work. And I did mention, I said, it may be a good idea to evaluate your sleep. Okay. Just because she was tired, she was on certain meds, she was, spread thin. And didn't push it. Right. She's like, well, let's get the dental work done first, and then I'll do that. Well, she never came back. So she died in her sleep.
So sad.
And I'm assuming, because it was a heart attack, she never woke up. One of the biggest contributing factors was the sleep breathing disorder. So she probably had some type of obstructive apnea, or maybe nasal obstruction, in addition to a joint issue as well.
Is that always set in your mind? Like, is it always kind of like there as far as like, whenever you think about what you're doing and where you've come with it, is, does that resonate? Does that pop up ever now?
Absolutely, because a lot of people that we see don't realize how poorly they are sleeping and poorly their immune system is operating because of that.
Let me stop right there. So this is where I give my testimony, and this is selfishly why I wanted, to have you on the podcast. So I will, those that are listening, everybody knows what a CPAP is, right? And I was trying to avoid that like the plague. There was no question that I was having sleep issues, but you just don't realize what they are because it's something that you slowly get to. You know what I mean? It's not like one day all of a sudden, it's like your body says, you know what, I think I'm going to have a sleep disorder. I think I'm just going to start choking myself awake kind of thing. It gets worse over time. Now, there's several contributing factors. Some is genetic. Some is, correct me if I'm wrong, some is genetic. Some is weight. Some is, there's anatomy. There's all
diet.
Kinds. There's a million different things that can affect it. But all I know was I was having it. And I just didn't realize how bad I actually had it. But Leslie, my wife, would tell me that, I'd wake up in the middle of the night, like strangling. And sometimes I wouldn't even know it. And I started to become conscious of it where I was waking up 3 to 5 times a night easily, having these issues. And so finally you convinced my stubbornness, because I didn't want to get on a CPAP, but he said, well, look, I can help you. Just come see me and we'll get it figured out. He said, I know I can help you. And so I stubbornly put it off for a while just because I didn't want, I'm sorry, I don't like going to the doctor unless I have to. But anyways.
Even if it's your lungs.
Yeah, no, look, I just don't, it's not that, I don't know, people are stubborn. And let me tell you, to those that are stubborn about this issue, don't be stubborn. And here's where the story gets better. So I show up, and then first things first, you put me under a sleep study. Now, it's not a sleep study. I appreciated you because your clinic doesn't push people to do it in the hospital where they restrain you like you're, a mental patient. And
nothing against in-lab. There's still a big need for that.
Right.
But this is a great alternative for patients, at least to get the initial evaluation. But I will clarify, even some patients after a home sleep test have to go to an in-lab.
Okay. Well, I was one of the fortunate ones. Right. Well, either way, even if I had to do that in the hospital, I would recommend people doing it because it was really eye-opening. That was the first piece. I came in, you examined, you gave me an examination, you looked everything over, and you said, yeah, I think there's something here. And I've had jaw clicking for years. Like, it's just part of, you actually watch my mouth when it moves. I'm like Sylvester Stallone. It's always swaying to the side. So there's some of that too. But anyway, so I get in the sleep test. I take the sleep test, and then the doctor from the sleep test, we have a FaceTime. And basically, he looks at my results and he says, Matt, he's like, he said, you are not getting good sleep at all. And let me be clear, up until this point, I did feel tired all the time, 100%. I felt like I was never rested. And I just attributed it to work, to grinding stuff out, to, just pushing myself hard, right? But I always felt tired. And then I was also honestly having a lot of sickness. I felt like I was getting sick at least once every month and a half, and I was wore out. Just not feeling great at all. And anyways, so that's the position I was in getting into it. And he told me in the sleep test, he said, you might be getting maybe 2 hours of okay sleep a night. He told me if I was laying on my side that, he said, you sleep okay. He said, but the minute that you turn on your back, he said, it's the equivalent of somebody holding your mouth and your nose closed for about 30 seconds and then allowing you to breathe for about 15 and then doing it all over again. And I remember him saying this specifically. He said, Matt, if I was doing that to you right now, he said, you would punch me in my face after about 2 minutes because he said, you get so aggravated. And then he started talking about the stuff that we know, like when there's lack of breathing, and you can get off into this, it's kind of fight or flight.
Right. So it puts you in high sympathetic tone, which increases cortisol, which is a stress hormone.
Mm-hmm.
So then you're fighting all night long,
Mm-hmm.
right? You should be in parasympathetic, which is rest and digest, healing, restoring.
Mm-hmm.
But if your body is fighting all night and then you've got a full workload like you do and you're busy, you're fighting during the day.
Mm-hmm.
So then you're staying in that high sympathetic season all day, all night.
Yeah, it's just constant. It's constant. And I've had some heart issues. I've had like stress-related heart issues.
It overworks the heart.
And so, I would go to the doctor about the stress-related issues, and he'd say, look, you're healthy as a horse. You can lose a few pounds, but, hey, working on it. And, but he would say, you're healthy as a horse. He said, I guarantee it's stress. And I'm like, well, I guess I'm going to die of stress because I thought this is just life. I don't know how to change this. I've tried to tone things down, but, life is stressful, especially if you're busy. In our season of life gets stressful. That's just part of it. I didn't realize truly that was a root for so many things. So anyways, after doing the stress test, and we'll talk more about it in depth here shortly, but you basically fitted me for an appliance. And my testimony is this, is like the first night, it was a little bit of a struggle because I hate stuff in my mouth. And, once we got it properly fitted and all that, the first night I was like, and so I ended up taking the appliance out at like 1 or 2 in the morning and then going to sleep, but I still felt a little bit better. But whatever reason, it's like your body recognized, wait a minute, dude, you got some sleep last night. Mm-hmm. So the second night I popped it in, and I just remember going to bed and waking up. I don't remember popping awake. I don't remember, getting up, because that's another thing too. If you got to use if I have any liquid on me, you got to, if you kind of come to, you're going to get up, and, if you're like me, you got to go, you're going to get it done, because you just don't like, have hanging on to that. And, look, I'm just being real here. Yeah, look. But anyways, got through it, and I just remember feeling absolutely amazing. And I was waiting for the new to wear off. You know what I mean? Like, this is fluke. But I couldn't wait to pop those dudes in and go to sleep because I knew I was going to get sleep. And I'm telling you, after the third day, this is how sleep deprived I was. After the third day, I remember like everything felt surreal because I actually had energy. And here's my testimony to it, is like I come to terms with, look what I've been missing because I haven't been getting sleep. And I will tell you, 6 months into this, we're into June, 6 months into this, I may have had a few instances where I felt a little run down, but I haven't been sick. In 6 months, I haven't been sick. And I've rested. I feel like I heal better. I feel like I've got better mental clarity. You name it. And all of the issues, stress too. My heart feels better. I haven't had any issues or felt like I was just overworked and run down. Now we get a little tired, but there's a difference between feeling tired and feeling like fatigued. Yeah. And I haven't felt that way. And so for those that are listening, please, just for a quality of life, y'all need to give this a shot, because I'm telling you, it made a big difference. Kyle is not paying me to say this. I'm pleading with people, and I've been telling you can ask a lot of my friends, because I'm like, dude, you need to get that checked out. I had a friend just the other day that, basically had told me that I ran into him, and he told me that his father had passed away, and his father died in his sleep, because of what was essentially the root cause of it was
The obstructive sleep apnea.
Yeah. And that's sad. He was 62.
Yep.
And we're not that far from that. You know what I mean? And anyways, all that to say, it just gives such a better quality of life. So, yeah, I mean, look into it.
What's that worth?
Right, exactly.
What's that worth?
Oh, yeah. Well, I mean, the expense behind what you do, it's not like the cheapest thing in the world, but it's certainly not the most expensive. But let me tell you this, I would have paid it 20 times over, knowing what I know now. Right. We buy so much crap on a day, trying to get fit or trying to lose weight or trying to watch out for this, trying to watch out for that. But I'm telling you, it affected things too. It has affected my weight in several ways too, because I now have the energy, because I used to work out regularly. I wasn't working out as much because I was so tired all the time. And I also found out too, that was another problem. I didn't realize the root cause, but like honestly, if I really stressed my body out, working out in that state of not getting sleep, I would actually get sick.
Right.
Like I would start feeling like I was sick if I had a hard workout, because I was just, you didn't have a chance to heal.
Body can only fight so many battles.
And yeah, I mean, it just truly affected everything. So, let me say it again, if you, get some help. And I will tell you something too, here's a little scary thing too. I didn't realize after I had crossed over, into getting regular sleep, I was deciding to take it. I was really tired. I had a long week. Sunday's our day of rest, other than church. Which church is restful too, but you know what I'm saying. Yeah. Everybody likes a good Sunday nap. And if you don't know what I'm talking about, give it a try. But I decided I was going to take a nap, and I knew I was tired. I knew I was going to go to sleep, in my chair, but I didn't grab my appliance. And so I fell hard asleep, and about 30 minutes later, I woke up going, and I felt like my heart was about to come out of my chest. And I thought to myself, wow, this is what I had been doing this entire time for years. Mm-hmm. And it was scary because my heart was pounding so hard and I just couldn't breathe. And I thought, man, that's no way to live.
No.
So, and that's when I contacted you and said, you need to come on podcast. Anyways, all that to say, so now I've given my testimony. Let's talk about the people. What are the signs? What are the symptoms? And let's talk both TMJ and let's talk sleep. What are the indicators?
Yeah.
So let's talk about it.
Yeah, and the majority of our practice right now, we're treating teenagers all the way up to 80 years old.
Mm-hmm.
In the future, we will expand and be able to serve more and more kids,
mm-hmm.
right? So the ultimate goal is to catch it in the development stage, right, to prevent future issues down the road, right?
Mm-hmm.
But if we're looking at just a lot of our TMD pain patients, so craniofacial pain, so if patients have a history of clicking or popping in their jaw joint, right?
Mm-hmm.
They may not have pain right now, but maybe they did,
mm-hmm.
right? If they have tension headaches, cluster headaches, some migraines, that can be indicators if they clench or they grind. So clenching and grinding is a response, and it's typically a response to one of three things that I've seen. Pain.
Mm-hmm.
So if you have pain in your joint, in your peripheral, and other areas of your body, right?
Mm-hmm.
Your back, your neck. So as you're sleeping and you're turning over, you're clenching. It hurts, right? If you have an airway collapse, so if your tongue is falling back, like for you, raises your sympathetic tone, you start clenching and grinding, your jaw starts moving forward to open your airway. Then if you have a nasal obstruction, that can also increase your cortisol, increase mouth breathing to cause clenching, right? So a lot of the things we see are responses to issues. It's an alarm, right? So anybody that's experiencing popping, clicking, pain in their joints, pain in their chewing muscles, tension headaches here, here, back of the head, neck muscle pain, if they clench or grind, right? I would love to help in any way I can, okay? And I will say a lot of the patients that we see are collaborative care patients, and that means that we try to reduce pain, inflammation, and increase range of motion. So we want more fluid movement. And we know that's key as we get older, movement. If you can't move, right, that's when you start having breakdown. We've got to keep moving. So you want to keep this operating just like any other joint, right? But once we get our patients to what we call maximum medical improvement, so we try to always shoot for 80% improvement. A lot of times we get more than that. Sometimes we get less, right? But every patient adapts and heals differently, depending on, right, age, health history, lifestyle, nutrition, right? Are they sedentary? Do they exercise? So there's a lot of other things that we have to keep in mind. But then we partner with a lot of, ENTs, physical therapists, chiropractors. There's some that we've got in with a functional med doc just to start dialing in their nutrition and their deficiencies, right? Some vitamin and mineral deficiencies is another one that we kind of talk about. So it's really just a whole body approach, and I'm not trying to be, but what I'm doing. I'm treating my scope. However, the knowledge that I've gained over my time, we can help guide patients in other ways, right? And we can kind of help them connect dots. So I'll look at it as
you address the direct issue, but also
the origins of their pain for what they come to me for, right?
Right.
But if we're fighting inflammation, we've got to figure out how we can reduce every aspect of inflammation we can. So if there's other areas we can work on, we do it, or we partner with someone that can help, right? Because my whole goal is to come alongside our patients during their health journey. And patients have to be ready, right? Because there's not a quick fix. It takes time, right? You were fortunate. You felt results fairly quickly. And sometimes that does happen, but not always. And
that's progressional in some cases,
right,
depending on,
right. So,
well, every body is different, literally, like.
Well, and also the careers now. We're in front of computer screens a heck of a lot now, right? And that posture, looking at phones, looking at a device, looking at a computer, if you have underlying issues already, and then you're posturing and straining this system, right? That's going to be another layer that we've got to address.
That's awesome. So obviously let's talk about the sleep disorder piece of it just real fast. I know all of those can exist simultaneously. What signs are we looking for with the sleep disorder piece of it?
Well, you've already mentioned some. If you snore, have a history of snoring, that's an indicator. Okay. If you clench or grind your teeth at night, indicator. If you're fatigued during the day, okay. If you have hypertension, if your neck for a male, if it's greater than 17 inches, for a female, greater than 16 inches, okay. If you're overweight, right. If you have a thyroid issue, okay, because there's a lot of comorbidities, okay, that are associated with this. If you, we had talked about the fatigue and the cortisol, right? So if you just feel like you can't get rested, you don't feel refreshed in the morning, right? If you get adequate sleep, when that alarm goes off, you should jump out of bed. You should be ready.
Mm-hmm.
But most people that are suffering, they drag. It's tough. They got to go. They got to hit that caffeine.
Yeah.
They got to take their meds.
Something just popped in my head. Let's talk about this real quick. So, no offense to people that utilize a CPAP.
No, yeah.
Yeah. I was trying to avoid it like the plague because I just didn't want that machinery. Right. You know what I mean? So what are some of because a lot of people don't know this. I remember you telling me, what are some of the downsides of utilizing a CPAP?
Yep. And I'm going to say the CPAP, according to the medical standards, is still the first choice, right? Still, I guess you consider it gold standard as far as I know right now. The problem is the compliance. Okay. Some people love them. My dad and my brother love their CPAPs. They love them.
I know.
So I'm not going to try to convince them otherwise. I'm not trying to convince people to make a switch. However, if joints are stable, right, and you have an option, if CPAP doesn't resonate with you, then you can consider oral appliance. Or if you try CPAP and you can't tolerate it, you can look at oral appliance, because some of the downsides, that's what we're getting to.
Okay.
It's a machine. It's forcing air down your throat, nose, depending on the mask you have. That's unnatural, right? There's a lot of parts and pieces in that machine. Okay, so there's masks, there's hoses, there's filters, there's humidifiers, tanks. So what happens when it gets recalled? Because they have gotten recalled, what do people do? If you can't get parts and pieces for your machine, how long will you suffer? Right? And then you become dependent on that machine. So you're in a worse spot.
I've heard instances where people have them and then they go without them and they have an issue because they don't have it. Right. And doesn't it also weaken the neck muscles and stuff like that? It can.
It can.
Some of the research I looked at, because I looked at one years ago, it says it can make this stuff more vulnerable, kind of thing.
Yeah.
It just, to me, and again, this is where I'm just speaking my testimony here. It just made more sense, because the appliance that I wear, and you feel free to jump in, but it basically just juts it's not uncomfortable, it just juts my jaw ever so slightly forward.
Yeah.
All I got to do is pop it in. It's no different than a retainer. It's kind of like a reverse retainer is what it is. And it's keeping my teeth as straight as possible while it's doing it. It's a double whammy. But that makes more sense to me and easy to carry. And it's, my body's utilizing, but it's also, it just makes more sense. And I get it. Some people prefer the CPAP and that sort of thing. I get all of that. But as far as easy to carry, I'm not having a line. I've heard some horror stories about guys that use a CPAP and it says it dries the throat out. And, this area needs moisture.
Right.
And so it just made more holistic sense to go the route of the appliance. That's what I was getting at. And to get the same type of result from appliance using my natural body, just literally pushing the jaw forward ever so slightly, I thought that's a win.
Yep.
And it worked.
Like I said, you were a kind of a more unique case, honestly.
Really?
Well, there's a period, we try to find the best therapeutic range for a patient.
Really?
And the problem you can get into is if you have a patient that has a joint issue and they may not be experiencing pain currently, but you put them in an oral appliance to manage their sleep and you advance them, that can cause a whole nother problem in the jaw joint and the muscles. So you may be helping the airway, but then you're increasing pain. So you've got to be able to manage both.
Well, there's a nice in between. So that's one thing you looked at with me. Right. You had suggested going a few centimeters forward, and I said, well, it feels a little uncomfortable. And you said, well, just dial it back. Well, even with dialing it back, it worked like a champ.
Right.
It was just, there's so much more that we could talk about this topic.
We'll have to do part 2.
Part 2, that's fine. I always ask, you will come on again, then you've already answered it. Fantastic. Okay, well, we'll do this again, but I wanted to introduce you and your services to the world because, again, it's made just such a big impact. It truly has. Everything is just so much better after getting this treatment. And so to anybody that's suffering with sleep or jaw issues, and I've had both, I would highly suggest seeking out Dr. Benton at Restorative because it truly has made such a big impact. It really has. My life is so much better because of the treatment. So, Dr. Benton, thank you for being on here.
My pleasure. Thanks for having me.
All right.